Gail Wilensky joining us here, senior fellow at Project Hope and economist. Gail, what was the most important inclusion or exclusion from the bill in your view?
The most important exclusion is we haven't figured out how to pay for physicians under Medicare. They are scheduled to have a 21% reduction in their fees come next month. Everyone believes that won't happen. It'll cost almost $250 billion to fix this problem. Worse yet, you can't reform health care if you don't figure out how to pay physicians correctly. It's a very big problem.
One of the things that we have seen talked about here is a MedPAC, an independent commission, kind of like the base closing commission, that would deal with Medicare payments, set those rates. Obviously, we know the healthcare system keys off Medicare payments. Does that go forward?
We'll see. I chaired MedPAC in its first 4 years of existence. I have a lot of respect for the commission. Whether or not you want to have this kind of commission be able to enact sweeping changes like how you pay physicians without having it be directly accountable in the way the HHS secretary is a whole different matter. I'm a little dubious that's the right way to do it, but we've got to be able to figure out how to pilot demonstration programs to pay physicians differently, away from 8,000 different billing codes that we now have, and we've got to do it in a hurry, and we have to figure out how to pay for it. $250 billion is a lot of money not to pay for.
And you don't think when you talk about the different billing rates, this kind of push towards all things electronic and computerized, you don't think that's going to help?
Well, it will assist, it will lower medical errors. We have to figure out how to put together into bigger packages of payment what physicians do. Taking care of chronic disease, diabetes, congestive heart failure, putting together all the charges for major interventions like bypass surgery. That's a very different way than what we do now. 8,000 different billing codes. You can't hold people accountable. You can't reward those that have good quality outcomes.
Well, what do you like in this bill?
Well, it does a good job of expanding coverage. 31 million people will have coverage that don't have it now come 2014. The problem is it doesn't tackle the really serious, difficult issues, how to slow down spending on health care and how to improve the quality for what we get. Interesting pilots and demonstrations, but pilots and demonstrations have a bad history of not actually making it into law. We have to get them up and running. Some of them will work, many won't. But then you've got to figure out how to actually get them incorporated into Medicare or health care. Those are very big issues. We could have seen triggers that automatically have them go into effect if they improve quality or lower cost, or hopefully do both.
We don't have a ton of time left, about 30 seconds. To what extent are you concerned that young people are going to pay the price for the older generations?
Well, there's no question that young people are going to see an increase in their health care costs very quickly because the allowable difference is 3 to 1 in terms of what insurance companies can charge. The real difference in costs is about 5 to 1. But of course, young people are going to face costs that are way beyond that. We have to figure out how to pay for Medicare, how to pay for Social Security. I encourage all of the young people that I know to get out, work hard, work long, work productive. They have to pay for the rest of us.
All right, Gail, we'll leave it at that. Thanks very much, Gail Wilensky, senior fellow at Project Hope.